I guess over the last year, we've all been living in a pandemic and offering services and doing things. People, now that we're well into a year into it, I guess people's frustrations and, emotions are heightened. And what's happening now, since we've had to also implement a wait list, is people are calling in. They're getting very frustrated when we tell them that we don't have a service immediately available, so that they'll have to, be put on a wait list. And there have been a few occasions, it's not everybody at all. It's been a few clients who have really gotten upset and have verbally attacked our intake workers, as well as some of our staff. I mean, they're using derogatory names, they're using threats of violence, they're really attacking them on a personal level, and that's just not okay. In general, at KSCS, having a wait list is something that rarely happens. It has, over the 4 years that I've been the manager of support services, we've probably had a waiting list maybe twice. So the fact that we're at this point in a pandemic and now have had to institute a wait list, so it's been about 3 weeks that we have one. It's not the norm. We are still offering every service that we have. The only thing is there's a little bit of a wait time. So we have approximately 56 service providers who are either psychologists or psychotherapists or art therapists or whatever you have, and those are funded through non-insured health benefits. So we refer, certain clientele out to them. Those 56 service providers are full right now, so we have to wait until they have a space available to refer the next person. In addition, we have 8 people who are doing mental health services within the organization. Those people are also maxed out, so we have to wait until someone finishes their service plan to be able to bring a new person in. In order to, I guess, address those issues, we've also, I don't know if you've seen, but we've had some postings lately. So we've managed to hire new people, but you can't hire a new person, have them start on Monday morning and hand them a stack of 30 files. You have to integrate them into the organization first. So that's why things are a little bit slower right now. But what we've done is we've implemented a triage system so that anybody coming in for services, will be informed that there is a waiting list. Then they'll be told that, there are other resources out there that are available if they need them in the event of an emergency. We have after hours response that is available 24 hours, 7 days a week, 365 days a year, and that you can contact through the peacekeepers. We also have Monday nights, the Let's Talk, that people can either text to or they can call and have a discussion. We're also going to be encouraging other community organizations, if they have insurances such as Sun Life or whatever the organization might be, to use their EAP services, to have their staff talking and connecting with someone. We also have our intake workers who are calling people who are on the wait list. They're calling them probably like once a week and checking in to make sure they're okay, reassessing where they're at. If somebody says to us, what, I can't do this, I'm really not doing well, then we will move them up the list and try to find something where we can help them better. We also want to make sure, though, that we're equipping our clients with some kind of coping skills so that they can be empowered to help themselves as well, because we can't fix anything for them. We can say, here's the resources, but as a client, you still need to do the work. So if something's not working for you as a client, it's really important that you call and you tell us that, look, I can't wait, or I need something sooner, things have gotten worse. And then we can look at how we can help you until you can be referred to somebody who's going to help you more long term. Basically, you call KSCS at 450-632-6880. Somebody's going to answer the phone and you're going to say, I really need to speak to the intake worker. The receptionist will then get the intake worker for you, and that person will take your call, take your name, your phone number, your information. Will potentially make an appointment with you to talk about what some of the issues might be and what it is you're looking for, and then they will follow up with you after that. It's a very simple process, and it moves very quickly.